Are you relying too much on lab tests to optimize your health? Here's why you may be doing more harm than good. Medical testing is a vital component of healthcare. Labs are used to help diagnose and treat diseases. However, in recent years, because they seem scientific, there has been a growing trend of individuals using lab tests to optimize their health. While this may seem like a good idea on the surface, it's important to understand that lab tests are intended to trigger warnings of diseases, not track health or longevity. One of the main issues with using lab tests to optimize health is that abnormal lab values may be normal or even optimal for a given individual. By contrast, a normal lab value could be significantly abnormal for an individual. So without doing a randomized controlled trial, it's impossible to say whether optimizing labs for individuals will result in improvements in outcomes, longevity, or functional status. Another issue is that the context of the lab matters a lot. If someone is having symptoms, having hair loss, fatigue, abnormal menstrual periods, then maybe we should look at their hormones. And if we also find some hormones that are outside of normal by a significant amount, maybe supplementing or altering those hormones will result in improved outcomes. But if someone is overall healthy and not really having any problems, then an abnormal lab may just be optimum for that patient. That may be exactly what they need, and quote unquote fixing it could be making things worse for that individual. The measurement method of lab tests also affects the interpretation of the results. A lot of these newer labs don't talk about how they are measuring some of these rare or unusual things. Just like if we compare direct versus indirect ion-sensitive electrode versus flame photometry, you can end up with different normals and different effects based on how the lab test is done. The history and status of the patient, their athletic status, their illness status, gender, age, and pregnancy status all affect what is normal. The whole point of a lab is to compare an individual to some other group to decide how close to average he or she is. If we over-segment the comparison group, trying to only compare to people with the exact same race and height and weight and athletic status and gender and age and all the other things, we'll end up comparing to a group of one, and you'll be comparing yourself to yourself. Additionally, we have to ask what studies have been done on the long-term effects of normalizing or optimizing those labs. For instance, iron supplementation improves athletic performance, but it also seems to worsen longevity. So do you want to trade off improved athletic performance now for an increased free radical aging process later on? It depends on your goals. But we don't know the long-term trade-offs for less common labs like zinc or telomere length or whatever. In the end, labs for asymptomatic individuals should be considered very blunt instruments. They're good for helping to flag severe disease, but they're awful for trying to optimize wellness because you're comparing to a population without context. And if you don't have a symptom, then the abnormal lab that you measure may in fact be optimum for you. You may already be at your optimum and you just happen to be outside the bell curve of that lab test. It's important to be thoughtful and careful about how we use labs, especially in the wellness space. It's also essential to have a thoughtful physician to partner with to start to dissect why anything may be abnormal or normal, and to put that in the context of your health status and your symptoms to piece together information, not merely react to the flag that comes from the lab. For all those reasons, labs should only be used for diagnosing diseases, not for optimizing health.